So let's start off by just doing the basics. So what is a cataract?
So within your eye, there's a lens. And there's actually multiple lenses within the eye, and we've actually talked previously about the cornea and diseases of the cornea, specifically keratoconus. But that is the most outer lens, and then inside the eye, there's a small structure. It is called the lens, and the function of this specific structure is to actually focus the image sharply on your retina, whether it's an object in the distance or an object nearby, close nearby. And as you age, this lens becomes dysfunctional. So a nice term that we use these days is called dysfunctional lens syndrome. And dysfunctional lens syndrome is starts off in your 40s, and that's where the long arm syndrome actually starts. And the long arm syndrome, that's where you start to need reading glasses. That is followed by a by the next stage where you'll have a little bit of yellowing of the lens, you start losing contrast, a bit of difficulty driving at night. And stage three is where you actually develop a cataract. So, and that's where there's an opacity forming within this lens. So this lens opacify, and no matter whether you wear glasses or contact lenses, the image will not be clear, because the rays entering the eye is actually blocked by by this by this cataract. So a cataract is not something growing over the eye, or like a growth over the eye that most people think it is. It is inside the eye, the lens becoming cloudy. And if you leave it in advanced stages that we rarely see these days, you can actually see a white pearl in the eye. So that's actually what a cataract is. If you leave it, that white pearl that all people might have.